It's funny, the whole business of teaching and learning is suddenly hitting hot.
Why? Why do you think that is?
People have suddenly figured out that teaching's not equivalent to learning.
The whole point here is to do things in depth that we can't do on the podium. Can we really expand on a topic and give you more than your 12 minutes?
It's a company devoted to improving our ability to become educated and interact.
The content is valuable, but what people really like to do is talk about the content. They like to talk about it with their peers. They like to talk about it with the podium presenters, even if it's by instant message or chat.
Travel and taking your time off from your practice is a luxury. And it's a luxury that many of us can't always afford to do.
Yes, of course, we see that also in Europe, and it can be a mistake if the patient has only pain. I mean, as I said yesterday in the meeting,
I've had a long time interest in small joint arthroscopy. And I don't mean just wrist, I'm talking about base of the thumb and small joints in the hand.
But there's always something on the cutting edge. And what I'd like to focus in on is the glenoid design.
What got you to take off time from your work and family life to come over to France for this course?
I mean, it's really been a passion of mine because, you know, back in the early 2000s, we certainly got caught with failures that we probably shouldn't have.
Si chiamava periartrite, ma in realtà erano questi tendini attorno alla spalla che si usuravano e infine si laceravano.
but in fact, no. The only thing that I observe is that it takes longer.
Why do you come to this course? What's good about this course?
Well, it's the best shoulder course I've ever been to.
One, this is a highlight educational meeting.
We moved our way down to a major player.
When I first started coming, it was just, you know, a handful of American surgeons, most with European ties.
First of all, we didn't have easy access to MR at West Point.
Okay. I think Jim Esch is a true force of nature when it comes to the shoulder.
You know, I'll tell you, what I worry about are my traumatic histories on patients who have this low-level or ligaments lax type habitus.
We have a special joystick. It is a long screw.
We're here at the Metcalf meeting with course chair Bob Burks.
Se stessa, tante infiltrazioni, ovviamente perdi.
Soft tissue loss, need for bone.
It's great to be part of the faculty here and to participate in this.
If we can grab those kids and get them to somewhere, to a good therapist where they can be redirected, we can prevent, I think, a lot of injuries from occurring.
And then my father went into medicine.
È avvenuto nell'ambito delle frequenti collaborazioni a livello internazionale dell'equipe.
That I can learn more about the width from that view.
Does the biologic integration of that base plate at the bone?
Because you can have the greatest products possible, but if you don't educate surgeons or have a focus to try to educate surgeons, it doesn't really matter how great those products are.
About the fourth or fifth time I've been to the course.
What we want to do is go through our current technique. I'm just going to put a little pull here and pop it in. Now, just at this moment. Tell me how you decided to come to this meeting.
If you're trying to move the center more laterally, how do you explain that to Dr. Gourmand?
Clearly, why we had a recession, things were overvalued. Things like land. Things that were probably undervalued would be things like medical education.
So there's continued education on the part of educating surgeons. What are the correct indications for?
Well, this morning I spoke about the different options you have in total shoulder arthroplasty related to the glenoid.
Because we went down this road in the 1970s. with Dr. Neer's idea.
So I think continuing medical education is a valuable asset, not just because it produces revenue, because it produces real value. That can
You ream the glenoid and you look and you have the scapular body there like a sail on a boat. You can't go any further medially. So you have to be able to build that up either with Pascal's technique or a thicker glenosphere.
Dr. Guanche, we should do a hip scope.
From Hong Kong and Japan and mainland China. How do you sort through this, and who do you choose? How do you decide to deal with one company as opposed to another?
It was at a time when HMOs were penetrating on the West Coast.
Boy, what a change of life that was.
So I used to say that removing cemented components was the worst part of my practice. Right. I've expanded it. It's the worst part of my life.
I mean, you have to wait 2, 3, 6 months before you get the same results in some patients.
Like it as far towards the edge as possible, but we also don't want it to pull out.
Responsiveness and a dedication to physician education.
Okay, so let's look at our graph. This is something you can get good at.
Basically, it's pretty pertinent to what you're doing on a day-to-day basis back at home.
I don't think most people could comprehend quite what this involved, and it should be rewarded. This is the type of behavior in people we want to incentivize.
It satisfies a need, and it's, I think and suspect it's going to be very successful.
Now, if you have a chance to work on this fourth dimension, to give some option to the people, to make that after the course you can bring everybody together to keep on having this discussion, and then to have this tape record on whatever, or to have an option to have an interactive internet discussion with these people. That could be very interesting because you play with the fourth dimension, which is time.